Okay, ma'am.
Yes, here is your first slide.
Okay.
Right, next.
Yes, I'm ready.
Yes, there is one more slide.
Okay.
Yes, you would have to speak little louder because I can barely hear you. So
Okay, ma'am.
if you, yes, thank you. If you've read and understood, considering it communication skills station, please begin.
Hello, my name is Dr. Ala Abdullah. I'm the C1 surgical trainee working for Mr. Man in the Royal Hospital. I'm calling the cardiology thoracic consultant for a pay for road traffic accident patient with widened mediastinum unsuspected aortic dissection. Can I confirm I'm speaking to Mr. Ofinklo, the
Yes,
cardiology consultant?
yes. Summarize your case, please.
Okay, thank you, sir. I have a 23-year-old male who has a background of diabetes presented to the ER with drowsiness and right-sided chest pain. On assessment of the patient, he has low GCS of 14. He is tachypneic with heart rate of 120 with mildly low blood pressure. On examination, the patient has left swallow side. He has left swallow inside, and we did investigation. We did X-ray, which shows bilateral cerebral effusion, suggestive of traumatic aortic dissection, and we did an X-ray of the abdomen with absent soul shadow and dilated bowel loop, so we are suspecting intraabdominal bleeding. He also has a left femur fracture. We recommended the CT scan, but CT scan is not available. Our management included giving him 4 liters of crystalloids and bending blood transfusion. We prepared 6 units of blood, and we inserted chest tube on the right.
Okay.
So I'm calling for your advice and for the acceptance of transfer into your care for urgent thoracotomy.
Okay. What will you do for the cervical spine?
Well, I will perform triple immobilization using rigid collar, sandbags, and a tape.
Do you think this patient is in shock?
The patient seems probably to be in shock, stage 1, stage 2, as he is tachycardic and he is a trauma patient, so most probably there is an internal bleeding, and the X-ray is suggestive of great vessels injury.
Okay. Please, can you speak up a little? I think your network is not so clear. Okay. So what type of shock does the patient have?
In this case, we are suspecting mainly obstructive shock, as the patient may have cardiac tamponade. There is also a possibility of hemorrhagic shock, as the patient has femur fracture, and there is bilateral fusion. And we're also suspecting cardiogenic shock in this case.
Okay. What will you do for the leg?
I will apply Thomas splint and retract the leg and track the leg.
What will you do for the blood pressure?
Well, we want to keep the blood pressure less than 100 because we suspected aortic dissection. We don't need the higher blood pressure to prevent extra bleeding and extra hemorrhage.
Why is the patient having metabolic acidosis?
We suspect this is due to the patient hypovolemic state, and maybe also the patient is diabetic, so he can be on diabetic ketoacidosis.
Okay. What other investigations would you like to add?
Well, I will wait for the CT scan. I want to do serial CT trauma for the brain, for the chest, and for the abdomen and pelvic. And I will also I want to do blood investigation, including CBC, and I repeat blood investigations.
Okay. What about the abdomen?
Yes, the patient X-ray showed signs of fluid collection, so the patient will need to do CT abdomen or fast scan, yes. True.
Do you think the patient will require an exploratory laparotomy?
Yes, we believe that the patient require exploratory laparotomy after resuscitation.
Okay. What are the laboratory abnormalities in the blood investigation?
There is the decreased hemoglobin of 8, and there is mildly increased CRP. Otherwise, his other blood investigations were normal, but the ABG showed metabolic acidosis and compensated metabolic acidosis.
Okay. Who will you send to accompany this case?
Well, I will accompany with me anesthetic for any unexpected intubation.
Why do you want to refer this patient to me?
Because I think the patient needs immediate intervention, as he has a great vessels injury. Maybe the patient has aortic dissection, so he need resuscitation with immediate intervention.
What is your differential diagnosis?
I'm suspecting traumatic aortic dissection, or great vessels injury, or cardiac tamponade.
What will you prepare in the ambulance during the transfer of this patient?
I will ensure I have CPR kits, CPR equipment, and another chest tube if the chest tube is filled or blocked. And I will also have with me an oxygen and fluid for resuscitation and blood for transfusion and blood kits as well, and intubation kits.
If the patient needs intubation while you're on your way, who will do it?
The anesthetist will do the intubation.
Okay. What are the sources of bleeding in hemorrhagic shock in this patient?
The patient may have bleeding from the chest, from great vessels, intrathoracic great vessels, or from the femoral fracture due to femoral injury, femoral artery injury, or intraabdominal bleeding.
What type of shock does the patient have?
The patient has most probably obstructive shock or cardiogenic shock, and we also suspect hypovolemic shock.
What is the cause of the obstructive shock?
The bleeding, the great vessels injury, can cause cardiac tamponade, which compromise cardiac function, especially dilatation and diastole.
Okay, doctor, you suspect a major vessel injury. Why does the chest tube show just 200 mils only?
There may be a block of the chest tube, and the chest tube is inserted into the pleural cavity.
Okay.
So bleeding might be from outside the pleural cavity.
What is the definitive management for aortic injury?
Immediate thoracotomy and repair, open thoracotomy and repair, or intravascular intervention.
In traumatic aortic injury, which part is usually injured?
The descending aorta.
If the widened mediastinum is due to cardiac tamponade, what is the treatment?
According to the status of the patient, if the patient is unstable, I will treat cardiac tamponade during thoracotomy. If thoracotomy is not available or not available at the moment, I will do cardiac resentesis.
Okay.
Yes, you can transfer your patient.
You can transport the patient.
Thank you.
Thank you.